guys, and welcome to my YouTube channel. My name is Joanna the nurse, and today I'm going to be giving you guys NCLEX tips. So this is, of course, obviously specifically for people that are close to graduating nursing school and that are ready to take the NCLEX. It's the national nursing examination that all nurses have to take before becoming a registered nurse. So I took it, and I wanted to give you guys tips on how to pass on your first try because that's what happened to me. I was pleasantly surprised. So here are some tips that I did that hopefully help you guys if you guys are studying for it. So the first things first is practice quizzes. Do it online because online you get the answers right away. It's super easy, and now in this world of technology, it's pretty much the way to go. So I do recommend doing practice quizzes online. I had that giant ATI book that I spent $40 on. I never opened it once. So, and I know there's practice quizzes in the back of there, but realistically, you'll most likely do it online. It's super easily accessible, and you don't really have to worry too much about, you know, where you can access it. You can always access it as long as you have internet and a computer. Personally, I found ATI useless. Any nursing student probably knows what I'm talking about. I really preferred Kaplan. So ask your nursing school if they do Kaplan or if they have like a Kaplan tutorial or something like that, because having access to the Kaplan questions and website really helped. I do feel like that is very similar to the NCLEX, so I do recommend really looking at Kaplan. Next, download NCLEX apps. So everyone always has their phone with them, and pretty much everyone has a smartphone now, and there are hundreds of NCLEX apps on iPhones or Galaxy Samsungs, so I do recommend downloading those. I even paid for them. So they were like $1 or $2, however, it was so worth it because again, you constantly, like every time you have your phone and every time you have 5 minutes or 10 minutes of downtime, you can just answer a couple of questions, and that really just constantly tests your knowledge. If you miss questions, then you can brush up on what you missed. So that's a great way of studying pretty much every single day without feeling like you really are studying, because really you are on your phone. Next, don't spend all day and night studying. So in all honesty, I doubt it'll make a huge difference. I didn't study day and night at all. I had a lot of distractions. I was working. You don't really retain much of the information when you're so tired. So just really focus on when you're in the zone, and that's when you should really go for it. Quiz yourselves with your friends. That's huge because the majority of your friends at this moment in your life are probably nursing school friends, and they are all super anxious, so they really want to study constantly. So when you actually talk out loud, and this is a great testing tip too, but when you want to talk out loud about a topic, so just say like, oh, you know, what is the answer to this? And if your friend gets it wrong, then you guys can explain together how to get the correct answer, because that makes a huge difference. A lot of times you really don't know how much you know or how much you don't know until you verbally say it out. So again, like if you ask a question and then somebody's like, oh, how did you get that answer? Then you can explain it, and by explaining it, that shows that you really truly understand what the question was about. Next, study guides. So study guides really help. Fill it out with acronyms, and there are so many study guides you can find online, you can find with your classmates, share a Google Doc. So utilize your classmates and utilize acronyms. That helps. So like this is my NCLEX study guide, and as you can see, it's a mess. It's 30 pages front and back, or maybe I exaggerated, maybe less than that. I actually did send it out, and then it actually does really help, but I have it with all of these different acronyms, such as like droplet, think of Spider-Man, like epidural puncture, sideline. So it's like these quick little notes with these quick little answers that are commonly asked in the NCLEX. So a study guide like this, I used it every single day. Next, so try and study without distraction. So as you can see, I am slightly distracted right now. I have my baby running around, my friends running around, helping with my baby. So try to study without distractions. Don't be like that. You know, close your door, get some tea, get some coffee, have some lights on, and so forth. A tip on the day of the test, Don't be stressed because really you know what you know and that's it. I got 65 questions, which is the minimum you can get. If it shuts off, then you either passed awesomely or failed miserably, and I did get the test shut off at that time. On the day of my test, I remember I was shopping online at abercrombieandfitch.com, and so that is what I did. That is my advice to you guys, and I hope that really helped. I will see you guys later. Thank you. Specific for don't spend, okay, so for, Luke is coming, and NAS, so thank you guys for, so thank you guys for watching. Luke was playing hide and seek in there, and I will see you guys later. Thank you. So, what's our Postmates?